Hello everybody, my name is Clune Mulvaney and I work in the Faculty of Nursing and Midwifery at the RCSI University of Medicine and Health Sciences. And I'm delighted to be here today to talk to you about our newly launched Clinical Bursary Awards. So I'm just going to share my slides here with you now. So hopefully you can see that here. So we're here to talk about the RCSI Faculty of Nursing and Midwifery Clinical Bursary Awards. So essentially, this presentation will provide an overview of the Clinical Bursary Awards, the eligibility criteria, the application process, requirements for the Clinical Bursary Awards, and the key dates, and particularly the submission date. So here's a picture of RCSI for those of you that may not know us, and we're based in St. Stephen's Green in Dublin. In terms of the RCSI, we're ranked joint second globally for good health and well-being in the Times Higher Education University Impact Rankings. RCSI is an international not-for-profit university and we're headquartered in Dublin with campuses then in Bahrain and also in Penang. RCSI is exclusively focused on education and research to drive improvements in human health worldwide. We're among the top 250 universities worldwide in the Times Higher Education World University Rankings, and that was in 2021. And we also have achieved an Athena Swan Bronze accreditation for positive gender practice in higher education. And there's a graphic with some of our key information that I will let you read in your own time. And it will be here and you can just pause and read the essential information. So for those of you that don't know us, in the RCSI, there's a Faculty of Nursing and Midwifery, a Faculty of Dentistry, a Faculty of Radiology, and a Faculty of Sports and Exercise Medicine, along with surgical training nationally. And in terms of school, we have the largest medical school in Ireland. We have a School of Nursing and Midwifery, School of Physiotherapy, and a School of Pharmacy. So again, our focus is on exclusively on health services. The Faculty of Nursing then was established in 1974. And we play a leading role in supporting the development of the nursing and midwifery professions nationally through the delivery of transformative learning experiences, impactful research in the areas of continuing professional development, and we have established a European Centre of Excellence to research this, and supporting the contribution of nurses and midwives to healthcare and societal well-being. Many of you may have over the years attended our annual international conference, which in 2023 will be in its 42nd year, and that takes place normally at the end of February annually. So the Clinical Bursary Awards are a new initiative and they were launched in April 2022 to coincide with the faculty's 40th anniversary of its annual international conference. So we believe in the faculty that nurses and midwives are central to the achievement of health, the national and global health targets and the achievement of universal health coverage globally. We believe very clearly that nurses and midwives are uniquely positioned to support the delivery of care to patients, clients and service users. And we believe that nurses and midwives are ideally positioned to take on more, do more, expand their practice more, contribute more and innovate more. And we have all seen very clearly throughout COVID the work that nurses and midwives undertook in terms of service redesign, reviewing, working with e-health and telehealth, and in order to ensure that patients and clients and service users were reviewed appropriately and their treatment plans of treatment care continued. The faculty is committed to supporting the nursing and midwifery professions in the delivery of efficient, effective, quality, person-centred care. Aligned to the strategic faculty plan, and our objectives, which were what I mentioned there, our three pillars are the delivery of transformative learning experiences, impactful research in terms of continuing professional development, essentially, and the contribution to the health and well-being of society. The faculty is absolutely delighted to launch and award a suite of new clinical bursaries to enhance the capabilities and capacity of nurses and midwives from graduate to advanced practice, and that's really important. So right across the spectrum, from graduate to advanced practice in the delivery of universal health coverage and population health. So the faculty will award 5 clinical bursaries, each to the value of €5,000 to registered nurses and midwives in the direct provision of health and social care across all practice settings. The purpose of the Clinical Bursary Awards, really, number one, is to showcase nursing and midwifery-led innovations. As we've said, from graduate to advanced practice in the direct provision of health and social care across all practice settings. So we want to showcase nursing and midwifery-led innovations. And number two, the faculty really wants to enhance the capabilities and capacity of nurses and midwives through seed funding. So this could either help launch something, further develop, drive and/or sustain something that's already up and running. So the seed funding can do all of those things, but essentially it is for nursing and midwifery-led initiatives aligned to current national health strategy towards the delivery of universal health coverage and population health. So all of you will be, I'm sure, familiar with the national health policy that is Sláinte Care. And again, the focus on these Clinical Bursary Awards is the nursing and midwifery-led innovations. So some of you may have an initiative that you need some seed funding to get off the ground. You may need to buy equipment. You may need to, let's say you had a clinical leaflet, a patient information leaflet that you want to make into a video. You may use the seed funding to do some of those initiatives. More of you may have started a process or an initiative, and now you need to take it to the next level, or equally to drive or sustain it. And again, that's where this seed funding of €5,000 can be very useful. The objectives of the Clinical Bursary from the faculty's perspective are very clear. So number one, we want to invest in and support nurse and midwife-led initiatives in healthcare delivery. Two, our aim is to strengthen and optimise the contribution of nurses and midwives to the delivery of universal health care and population health. And three, we want to support and enable nurses and midwives to maximise the full potential of your education, training and licence. So all very, very, what will we say, we hope worthwhile and important objectives for us to achieve. What are the types of clinical bursaries? So there's three distinct categories, and we're very conscious that there could be individual applications, that again, you have an initiative that you want to progress on your ward, your unit within your organisation. Two, there could be team, ward, unit, department, organisational-led nursing and midwifery initiatives. And three, there's scope then for the specialist and advanced practice practitioner to obviously apply for clinical bursary. So they're considered across all of those three categories. And eligibility, who is eligible to apply? Well, the good news is that the Clinical Bursary Award is open to all registered nurses and midwives in Ireland. And that is regardless of your area of practice, your speciality. And again, we're talking from graduate nurse right across the spectrum, all the way up to registered advanced nurse practitioner. So now in terms of what you are required to demonstrate in your submission. So essentially, there's an application form on our website, and you're going to fill in your information there, whether it's individual, team, or again, a specialist advanced practice application, where you submit your names, your work contacts, your work address, your title, job title. And then there's a section that asks you to complete that are specifically required in order to be, and these are the criteria by which the reviewers will be examining each application. So again, you're going to have a brief introduction as part of 2,500 words in total. Little introduction as to the background and what the project is about, or the initiative. The second thing that we will be looking for is that it's an evidence-informed and needs-based rationale for this initiative. So again, you could be using figures from the CSO, you could be using figures from HYPE data, you could be using figures from your service, from your ward, but again, you're going to be back to the evidence and policies and some kind of absolute evidence to inform why this rationale is important, and again, what are the needs underpinning it. Three, you need information on the relevance and alignment of the initiative to Ireland's current health policy. So policies for nursing midwifery and its alignment to the faculty strategic pillars. So our faculty strategic plan is on the website. And again, the three broad pillars are around transforming, delivering transformative education, two, leading impactful research, or three, the contribution to the well-being and health of society, to nurse and midwives, I should say, and society. You need then to consider information on how the initiative is being or will be developed and is being or will be implemented. So we're very conscious that some of you may have initiatives that are started already and now you're moving them to the next level or trying to enlarge them, or you're trying to make them more sustainable. And again, other initiatives may be something that's been done on your ward, your unit, within your organisation, within your service for the very first time. You need to consider information on the potential tangible and positive outcomes of the initiative for patient safety and quality of care and or service delivery. You need to consider and present some information on the potential tangible and positive outcomes of the initiative on the experiences of patients, clients or service users in the health and social care system. You will need to consider information on the potential positive outcomes of the initiative for patient, clients, service users and for service delivery. Information and preliminary costings will be required on how the bursary will be spent in the development implementation of the clinical practice initiative. And again, we understand that these may be preliminary, and again, the clinical bursary may go, so it may not cover all of the costs for certain initiatives, but again, they may get you up and running with something that you want to bring in to enhance service delivery for your patients or for the quality and safety of certain processes within your area of practice. We then want you to consider what is the plan, if any, potential for sustainability in the service in which the initiative is implemented. So if you initiate this initiative, how can it be sustained or maintained over a longer term? What are your potential plans there? And number 10 there you'll see is plans for scaling or spreading the initiative or the improvement, you know, how it could be replicated in other services potentially, and a short conclusion. So all of this, the submission guidelines, those factors must be addressed. And the applications must be presented obviously clearly and coherently, and you have a maximum word count there of 2,500 words. And the important thing is in the application documentation that are available on the website, it will indicate the marks that are awarded to each of these areas. So you'll see that some of the weight is specifically focused on how these aspects are weighted is much higher in some of how they impact on patients, on quality, on safety, on patient-client experience. And some areas are awarded 20 marks and reviewers have a maximum of 20 marks to award, whereas other areas here have an award of marks of 5 marks. So again, you will be able to determine where you maybe need to be provide more detailed answers in terms of what is required in the submission. And again, I would always advise, you know, if there's more marks awarded to a section by the reviewers, well, then that obviously needs more information than an area maybe with less marks. So, but we are not prescriptive and we don't decide how many out of the 2,500 words go to each section. And again, that's for you to, when you consider all the areas that are required, the marks that are allocated against them, I think that will give you a very good sense of where you really need to focus some of your answer and the detail in your submission. So just in terms of what will be required if you should be successful and win one of these awards. So all clinical bursary awardees will be required to furnish the Faculty of Nursing and Midwifery with an annual progress report until the project is completed, and that enables faculty to oversee the project and have oversight of the finance. Showcase their initiatives. So with the faculty. So again, we would all awardees will be required to hopefully showcase their initiative at the faculty's annual international conference. It will be presented in faculty's annual report, fellows and members events potentially, and other relevant fora within the faculty. And we would also, as a requirement for all clinical bursary awardees, it will be a requirement that the faculty is acknowledged in all outputs. So again, that could be presentations, publications, etc. relating to the award. In terms of the application process, I'm going to invite you now to go onto the website www.rcsi.com, Dublin about Faculty of Nursing and Midwifery, and there you will find the information on the Clinical Bursary Award. So there's the same detail I'm after going through is there in a beautiful document. The assessment criteria and the scoring is absolutely identified within those documents. So it's worth spending a little bit of time reading those documents documents, understanding what is exactly required, and then determining how you're going to complete your application. So the key dates that are important now is that the closing date for applications is 12 midday, Friday, the 25th of November 2022. And as I've said, the word count for the submission, now that's outside of names and addresses and the different applicants, is 2,500 to answer those specific points. The applications then will be reviewed over December 22, January 23, obviously depending on the numbers. That process, this is the first time we've offered clinical bursary awards, so there's time allocated there to review them by reviewers. And during our conference, so the faculty's annual conference takes place on Thursday, the 23rd of February, and 22nd, actually, there's a nighttime, there's an evening time dinner. So the awardees will be announced and obviously a presentation made to them at that point. So the most important deadline for now to consider is Friday, the 25th of November 2022. And again, just note the 12 midday. That enables us to be here to support you if there's issues with submitting your final application. And the details for where you submit are absolutely available on the website. So again, there's just a nice graphic of RCSI, our new building across in 26 York Street, and our mission there is leading the world to better health. So just to close with that. And if you have any questions or queries, my email is here. It's ccmulvaney, that's Catherine Clune Mulvaney, Mulvaney at rcsi.com. My colleague Anya Halligan in administration will manage this process from an administrative point of view, and her email is there, anyahalligan@rcsi.com. So if I haven't answered all of your queries or questions during this presentation, please do not hesitate to contact me. And you'll see from our Twitter page that there are live interactive sessions planned over the coming weeks and, ahead of the deadline. So please log on to one of those where we can discuss it in more detail. And again, not even discussed in more detail, but that you have the opportunity to ask questions that I may be able to answer. And again, if we don't have the answer, I will find the information for you. So I hope this is of interest to many of you and something that you will consider in the weeks ahead. Thank you. Thank you so much. Bye now.